Hey everyone, welcome to Calm Mind, a space where we explore mental health, find calm, and grow stronger together. Clinical depression, understanding major, postpartum, atypical, melancholic, and persistent depression. A full psychological breakdown. Have you ever woken up in the morning with a sense of overwhelming heaviness, not just in your limbs, but in your spirit? As if the world had lost its color, your favorite hobbies feel like chores, and joy feels like a distant memory? You're not alone, and what you may be experiencing is far more than just a case of the blues. Welcome to a deep, human, and scientifically rooted journey into clinical depression, one of the most misunderstood yet pervasive mental health disorders of our time. We're not just talking about feeling sad after a bad day or tearing up during a tragic movie. No. This is something different, something deeper, something that affects more than 280 million people worldwide, yet often hides behind a forced smile, a late text, or a canceled meeting. In this comprehensive breakdown, we'll explore every layer of clinical depression, from its biological roots to its emotional toll, its various subtypes like postpartum or melancholic depression, and most importantly, how people can find hope, treatment, and healing. This isn't just information. This is life-saving awareness. This is the science of healing the mind. So stay with us, and let's walk this path together. Part 1. What is clinical depression? Clinical depression, also called major depressive disorder, MDD, isn't just a bad mood or a tough day. It's a diagnosable, often debilitating mental health condition that significantly interferes with a person's daily functioning. From your ability to focus and sleep to your appetite and social relationships, depression casts a shadow over every part of life. What sets clinical depression apart from everyday sadness is its persistence, intensity, and impact. Imagine trying to live with your emotional volume turned down to a dull hum, where even joy feels muted. Or picture having a mental fog so dense that even brushing your teeth feels monumental. We now know that MDD is one of the leading causes of disability around the globe. It affects people of every race, age, gender, and background. For women, the lifetime risk can climb as high as 20%, and for men, around 12%. These are not rare numbers. This is a public health crisis hiding in plain sight. But what actually causes it? And why does it affect people so differently? Part 2. The root causes, a complex web of factors. There is no single cause of depression, and that's one of the reasons it can be so difficult to understand and treat. Instead, think of it like a perfect storm, a convergence of biology, genetics, environment, and psychology. Let's start with genetics. If a close family member has depression, your risk increases significantly. Studies show that people with a first-degree relative who suffers from depression are 3 times more likely to develop it themselves. This doesn't mean it's guaranteed, it just raises your vulnerability. Biologically, depression is closely linked to brain chemistry, particularly the balance of neurotransmitters, like serotonin, dopamine, and norepinephrine. These brain chemicals are responsible for regulating mood, sleep, motivation, and pleasure. When their levels drop, or their signaling is disrupted, emotional well-being often suffers. But biology doesn't act alone. Environmental triggers like trauma, loss, chronic stress, or abuse can act like sparks in a dry forest. Combine that with a genetic predisposition, and depression can take root and spread. Psychologically, people who are more prone to negative thinking patterns, low self-esteem, or rumination, replaying distressing events over and over in their mind, can be more susceptible to depressive episodes. Real-world example? Consider Giap, a high-achieving student with a perfectionist streak. After a personal loss and months of overwork, he begins to withdraw, loses interest in school, and starts experiencing insomnia. Despite external success, he's spiraling internally, a classic depiction of MDD emerging through the convergence of stress, personality, and biology. Part 3. The subtypes of clinical depression. Clinical depression isn't a one-size-fits-all condition. There are several recognized subtypes, each with unique features that influence how it is experienced and treated. First, postpartum depression. Often occurring after childbirth, postpartum depression involves intense feelings of sadness, anxiety, and exhaustion that can interfere with a new parent's ability to care for themselves or their baby. Hormonal shifts, sleep deprivation, and overwhelming responsibility contribute to its onset. Surprisingly, men can experience this too, though it's more common in women. 2. Atypical depression. Unlike most forms of depression, those with atypical depression experience mood reactivity, a temporary lift in mood in response to positive events. Other symptoms include increased appetite, weight gain, excessive sleeping, leaden paralysis, and rejection sensitivity. 3. Melancholic depression. This severe form of depression involves a lack of pleasure in all or almost all activities. Even joyful experiences offer no relief. People may suffer from early morning awakening, weight loss, excessive guilt, and psychomotor agitation or retardation. 4. Persistent depressive disorder, dysthymia. This chronic form of depression involves milder symptoms that last for at least 2 years. It may not completely paralyze day-to-day functioning, but it causes consistent feelings of sadness, fatigue, and low self-esteem. Many people with this form feel like they've always been this way. Understanding these subtypes helps both clinicians and patients identify what they're dealing with and customize treatments more effectively. Part 4. Diagnosis. The DSM-5 criteria. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, a person must experience 5 or more of the following symptoms for at least 2 weeks to be diagnosed with major depressive disorder. Depressed mood most of the day, markedly diminished interest or pleasure in activities, significant weight loss or gain, insomnia or hypersomnia, psychomotor agitation or retardation, fatigue or loss of energy, feelings of worthlessness or guilt, diminished ability to concentrate, recurrent thoughts of death or suicide. Importantly, these symptoms must cause significant distress or impairment and cannot be explained by another medical condition, substance use, or manic-hypomanic episodes. Part 5. Paths to healing, treatment, and recovery. Depression is treatable, but not always with a one-size-fits-all approach. Treatment typically falls into 2 main categories: non-pharmacologic and pharmacologic. Non-pharmacologic approaches: psychotherapy, talk therapy, cognitive behavioral therapy, CBT, interpersonal therapy, IPT, and other modalities offer tools for reframing negative thoughts and building emotional resilience. Exercise. Regular physical activity boosts mood-regulating chemicals like endorphins and serotonin. Nutrition. A balanced diet rich in whole foods, omega-3s, and antioxidants can subtly influence mental health. Mindfulness and meditation. These practices reduce stress and improve emotional regulation. Pharmacologic approaches: SSRIs, selective serotonin reuptake inhibitors. Common first-line medications like fluoxetine or sertraline increase serotonin availability in the brain. SNRIs, MAOEs, and tricyclics, other options for those who don't respond to SSRIs. ECT, electroconvulsive therapy, a last resort but effective option for treatment-resistant or severe cases. Part 6. The hidden battle, stigma, and support. Perhaps the most dangerous aspect of depression isn't just the symptoms, it's the silence. Shame, cultural stigma, and misinformation often keep sufferers from seeking help. We must collectively dismantle the myth that depression is a sign of weakness. Mental health is just as real as physical health, and no one should suffer alone. Social support, from family, friends, community, or even online networks, can significantly improve outcomes. The simple act of reaching out, checking in, or being present can make all the difference. lesson in humanity. Depression does not define a person. It's not a failure, and it's not a flaw. It is a condition, treatable, navigable, and survivable. Let this video serve as both a guide and a reminder. You are not alone. Whether you're struggling yourself or supporting someone who is, there is hope, there is help, and there is healing. If today feels dark, please hold on. The light does return. If you found this content helpful, consider subscribing, liking,